experience of patients in the NHS is still poor. That's according to two surveys out this morning. The British Social Attitude Survey suggests that 59% of adults are dissatisfied with the health service. Meanwhile, another study suggests 1 in 10 people feel that they've been harmed by the NHS in recent years. Dr. Tony O'Sullivan is co-chair of the campaign group Keep Our NHS Public, and he joins me live on LBC News Breakfast this morning. It's great to have you with us this morning, Doctor. Let's just talk about the number of people then who feel that they've been harmed by the NHS. It's a significant number. What is going on here? Is this down to a lack of training or sheer incompetence from staff?
Well, good morning. It's absolutely not due to incompetence of staff. Obviously, any health system isn't perfect, but we know that over 35% of the people who responded saying that they'd been harmed were saying that they'd been harmed because of delays in treatment and not because of the treatment itself. The NHS has been severely damaged by 14 years of underinvestment. I think probably most people recognise that. And when Wes Streeting brought Lord Darcy in to do a very thorough report over the summer, and he reported in September, he was saying that there's nothing wrong with the NHS model itself. It's been severely underfunded. The vacancy rate in staff and the damage done to the hospital estate and the old equipment and lacking equipment were the fundamental reasons why patients weren't being seen quickly enough and weren't getting the treatment that they needed. So I think we have to ask ourselves why this is going on and not just respond to some of the failures that are evident. I was very encouraged by the response of the public in this survey itself. 90% of them agreed with Lord Darcy, essentially, by saying that they still support the principles on which the NHS is founded, free at the point of use and funded from general taxation. 70% of them said that too little money was being spent on the NHS, and 72% of them said that there were not enough staff. So I think that the general public is ahead of government in these issues. I would say that we can't afford not to have a functioning health service that meets the needs of the population. We've got nearly 4 million people out of work for health-related reasons, and that's gone up over 1 million since the COVID period. If we don't have a health service that meets those needs, then we won't have a functioning economy. And I think the priorities that the government need to have include putting the NHS back on its feet, alongside, of course, social care. So those that are the takeaway messages for me from this survey. The public generally respects the NHS, but it wants it looked after by the government again. It wants the staff funded properly. It wants the equipment and the estate put back together again. And we can have a health service that was so good in 2010 that it was regarded as the best health service model in the world.
So what you're describing there is a service which is under intense pressure, and you've just said there that it was so good back in 2010. Do you see at any point where we could return to those levels again that they were back in 2010?
I have no doubt about that, Vanessa. Unfortunately, the NHS goes in cycles depending on the political attitude towards it from government. And at the end of the 90s, when there was a change of government, the NHS was in a really parlous state then again, and people were waiting 2 years for operations and so on. A&E was pretty well awful, long waits, carnage, etc. And what happened in the 2000s was not, I would emphasise, as Wes Streeting has said, that private sector treatment centres came to the rescue of the NHS. It was funding into the publicly provided NHS that actually switched that whole thing round. And it was NHS staff and NHS hospitals and GPs that made the waiting list problem go away and made treatment in A&E so effective. So by 2010, over 90% of people were being referred to hospital and receiving their treatment within 18 weeks, over 90%. And over 95% of people who were attending A&E were either treated and sent home or treated and admitted to hospital for the course of their treatment. Now it's over 7 million people are waiting. Instead of waiting 18 weeks, they're waiting 18 months. And people in A&E are waiting, having delayed treatment to such an extent that 14,000 people are dying avoidably in a single year. That's the Royal College of Emergency Medicine that says that. And I think that evidence-based knowledge that the NHS works should inform the government that they should face this as a national health emergency and make the funding available. And there are 20,000 doctors facing unemployment this summer if we don't employ them. That's crazy. There's over 30,000 nurse vacancies in the NHS. We've got to fix this urgently, and the NHS will respond if it is supported and funded properly.
Message loud and clear. Thank you very much indeed, Dr. Tony O'Sullivan, who's co-chair of the campaign group Keep Our NHS Public.